Hi, I'm Sally Santon. I want to talk to you about a course that we're going to be offering called Teaching Clinical Skills. First, let me tell you a little bit about my background. I'm an emergency medicine physician and I practice at the University of Michigan Medical School in the emergency department. A couple of years ago, I decided to go back and get a PhD in education. And you might ask why. It's probably for the same reasons that you're deciding or thinking about taking this course. In medicine, we have this paradigm that's called see one, do one, teach one, which means that once a student gets to see something, they then get to try to do it, and then they get to teach it. When I first started as an attending, that really kind of bothered me because I felt like I didn't know enough to be able to teach, and so it was for that reason I went back and got a PhD. My guess is that those are the same reasons that you're deciding to take this course, is that you would like to improve your teaching skills. Now let's talk a little bit about the course, because it's a bit different from some of the other online courses. Many of the online courses are looking at specifically knowledge, and knowledge acquisition and knowledge application. This course is different because we're trying to teach you a skill. We're trying to teach you how to behave and how to perform and the skills of teaching in the clinical setting, which is different than many of the other things that you do. It started with a workshop that I have done for a number of years with various colleagues on providing feedback skills. And so what we wanted to do was to take those skills and apply them to this course and expand it to do some other topics as well. And so what you'll find is that the format of it is somewhat different. I'm going to ask you to watch some videos, to discuss some videos, to be thinking about things. And then in the end of each of the sessions, I want you to go out and apply what we're doing. I want you to go and use the skills that we've been trying to build. Because if you simply learn how to provide feedback, but you don't ever do it, then you're not going to actually have the skill to be able to do it. This is based on works by Anders Ericsson. Anders Ericsson is a PhD in education, and he has a theory that you have to do things many, many times, in fact 10,000, before you become an expert. And so you can do things as many times as you want, but unless you actually have feedback, you're not going to get any better. And so the important part of the practice of this is that when you go out in your clinical setting and you practice, for example, providing feedback, or you practice orienting your learner, be sure that you're getting feedback either from the learner or from a colleague so that you can improve on your performance. That's one of the key foundations of this course, is that after each session I'm going to ask you to go out into your setting and to actually apply and use the skills that you're learning and get feedback on it and reflect on that and try to improve. So let me talk a little bit about the content of the course. We're going to start with providing clinical feedback, and that will teach you the skills of giving feedback to your learners. The next segment is about orienting your learner. It's to help your learner understand in the clinical setting what they need to know and how they can perform best in the setting that you're teaching in. The next segment will be kind of a connect time or a discussion time or an integration time. It means that I want you to really go out and practice these skills and then have a discussion with your group and with us about what's going on and how it's working and how we might do better so that we can be learning from each other. I know that there's a great expertise in the group, and the hope is that we can build on that expertise during those Connect weeks to be able to improve all of our skills. The next session is going to be on RIME, which is from Lou Pangaro, which is Reporter, Interpreter, Manager, Educator. This session is to help you think about assessing or recognizing the level of your learners so that you can get them to a higher level. The next piece is then about entrustment. Entrustment is a little bit complicated, so I'm not going to go into it deeply, but it's the sense that we give responsibility or autonomy to our learners so that they can practice more independently in their setting. And then the final piece will be, again, an integration connect time, where I expect you to go out and to perform these skills, to practice them, to get feedback, and then to bring that expertise and experience back to the group so that we can all learn and improve from that time. So those are the sessions that are planned for this time. I want to talk a little bit about the context or who this is aimed at. It was aimed specifically at physicians, but I think that it could be helpful for all groups of clinical teachers. That if you can think about the concepts and the ideas that we're using and extend them into your context of nursing or pharmacy, that you will also be able to use some of the concepts that are used here. And so it's not only for physicians or nurse practitioners or PAs, but I think it can be used across the context. So let's talk one more thing about the course, and that is that it's important that you really engage in it, that you join the discussion periods, and that you practice at the end. All right, look forward to seeing you.